Okay, so we're going to be discussing the Arts and Health Grant. This is an overview and application walkthrough for the April 2026 deadline. Just to give you a brief overview, I'm going to introduce the program, give you the program goals, eligibility, funding rules and restrictions, how to start your application, the evaluation criteria and definitions, a walk through the application, and then questions at the end. So this program, the award amount request can be up to $9,500. This is up higher than the adjusted amount from last year. The grant was a $7,000 request last year. There's some additional components with this, with a peer learning cohort, as well as a required evaluation component I'll get into later, which is why we are allowing a request up to $9,500. And for this grant, who can apply is a 501c3 nonprofit organization based in Rhode Island, and new and special for this cycle, organizations who have received general operating support in the past can apply at this deadline. For those of those organizations who were on the call last Thursday, there was an explanation of a change in the application for general operating support. And because of that, we're opening up the Arts and Health Grant this cycle. And because this grant is funded by the federal funds from the NEA, we are not able to take fiscally sponsored organizations for this grant this cycle. So this Arts and Health Grant supports arts and cultural projects or artist in residence programs that contribute to overall health and well-being for individuals and communities. So arts is the focus of this grant project. And new for this year, specific because of our NEA funds, this will fund organizations to design and implement arts-based projects that strengthen social connection and a sense of belonging. Direct participation is a core element of the project. Non-clinical art activities may take place in health-based or community spaces. And during the project period, again, this is a new piece of this grant. The grantees, as well as the artist involved in the grant, will participate in a arts and health peer learning cohort. And grantees will be required to use a brief RISCA-provided survey tool and to participate in a focus group at the end of the project. And I'll get into more of those details as we go along. So the timeline for this grant, it's now open, February 1. We're doing uh, grant support and application drop-in office hours during February and March. The deadline for the grant will be April 1st, and the funding period will support projects between July 1 and June 30th, which is the state's fiscal year. Grant notifications will be sent out in mid-June. That's always tentative because it depends on the governor's approved budget. And then for this grant, as I mentioned, the grant will kick off with a peer learning cohort meeting in September. And then the peer learning cohort will meet a couple times during the grant project period and will end with a focus group. And then with all our RISC grants, there will be a final report due July 31st. So eligibility for the Arts and Health Grant, again, direct participation of the artist is a core element of this project. It's not tangential. Arts is the focus of this. And this is for non-clinical art activities. This isn't for diagnosis. This isn't to treat an illness, but that arts are important to the health and well-being of the participants and might have therapeutic outcomes, but they're not used to cure an illness. A health professional or subject matter expert is an advisor on the project. For evaluation, there is going to be a brief survey tool that will be required, and again, to participate in the peer learning cohort. And I'm just going to give a couple project examples. I'm happy to talk about this later because I don't want people to think this is the only thing that you can do. But just to give a sense of arts-based engagement with artists being the main focus. So, for example, a group of artists, caregivers, older adults, and public health workers could co-create a temporary listening infrastructure over a 4-week period. The project consists of a series of artist-designed listening stations installed in non-traditional locations, such as a laundromat, barbershop, or clinic waiting rooms, where community members are invited to pause and listen to short audio works created from local voices and then optionally record a response. Another example is a dance company hosts an adaptive dance artist for a 6-month residency at a rehabilitation center for residents and staff to improve physical mobility and confidence and to strengthen social connections and a sense of belonging. Another example could be a community shelter partners with a mural artist to work in collaboration with both the residents to create the artworks that might communicate the experience of homelessness. The final art would be displayed to continue to uplift and celebrate the participants and to improve their sense of self-worth and belonging. In addition, the mural lasts as a visual storytelling tool to the community to help them respect and better understand the causes and challenges related to homelessness. And again, these projects are trying to give a sense of both health and public health projects that have art at the center. And for eligibility, and because organizations are the ones applying for this grant, you must be a nonprofit organization conducting business and be incorporated in the state of Rhode Island with a 501(c)(3) tax exempt status. You must be registered with the Secretary of State and governed by a revolving board of directors, trustees, or advisory board drawn from the community at large. If you're an out-of-state organization, you may still be eligible, but you still must be registered with the Secretary of State. Principal place of business is here in Rhode Island, and the programming is in Rhode Island, and again, governed by a revolving board of directors, trustees, or advisory board, drawn from the Rhode Island community. And if you have any questions about that, you can always reach out to me. Also, an organization needs to have a unique entity ID, which you can get from sam.gov. The funded portion of the project must take place in Rhode Island. The spaces where the project activities take place must comply with the Americans with Disability Act. And the organization cannot be applying for another grant at the same deadline. You cannot request support for this project or aspects of this project through another risk grant program. And you can't already be receiving direct funding from another risk grant. And you cannot be delinquent on any final reports for previous risk grants. So just to clarify for this, there are 2 arts and health grants this cycle, so you would have to select one or the other, and you would not be able to apply to both. So funding rules and restrictions. There's a list of things that are required and, need to be compliant for the funding. So all grant awards are contingent upon the availability of funds from the Rhode Island General Assembly and the NEA. The maximum grant award for this category is $9,500, but we often give out partial awards. They won't be any less than 50% of the application request or $1,000, which is higher. We definitely take into account that we want it to be feasible for you to be able to do this project in some capacity if the panel reviews it and scores it accordingly. But also you always have the time, you always have the ability to be able to, choose not to take the funds if, you didn't feel like they're enough to complete the project. Yeah, as I said, if you receive partial award, you may modify the project. You can always reach out to me to discuss any modifications if you don't get the full award. But take into account for this cycle, there'll still be a requirement to participate in the peer learning cohort and the evaluation component if you choose to accept the award. But again, if you decide not to take the grant, there's never penalties. We never, you know, discriminate against deciding not to take the award this time because the timing might not be right. And if you get the grant, you must credit the agency on all marketing materials. We have more information about that on our website. So for not allowable expenses, there's a number of things listed here. I won't go through all of them. They're listed in the guidelines. Happy to answer any questions if there's any specifics about that. For the panel that will be reviewing the grant, again, RISCA staff are not panelists. We never make the funding evaluation. We never evaluate the grants and make the funding recommendations. The panel will consist of 3 to 5 individuals. At least one of them will be working in the arts and or health sector. At least one will be a professional artist, and there will be individuals who will be representing both the arts and the health sector. The individuals who work at state or local arts agencies or at similar vantage points in the arts and cultural ecosystem. And the panel reviewers will use the evaluation criteria to evaluate and recommend the applications for funding. So the evaluation criteria and the definitions. The evaluation criteria will be using the following criteria to evaluate and recommend applications for funding. There'll be logistics, artistic vibrancy and impact, and the health benefit. So for logistics, the application clearly states what will be done by whom, when and where things will take place, and how this project will happen, both logistically and financially. The applicant indicates relevant metrics to measure their progress. In the artistic vibrancy and impact section, the art is central to this project. The artist or artists will provide a positive and purposeful experience for the participants. And this project provides access or engages underserved communities as identified by the NEA. And I put that down here that the NEA defines underserved communities, which is ones in which individuals lack access to arts programs due to geography, economic conditions, ethnic background, or disability. The arts and health section that will be evaluated is the project specifies how engaging in the arts will strengthen social connection and or sense of belonging and overall well-being. The health and or community partner and artists are integral to the design and implementation of the project. And then there is a clear plan on how to measure the core indicators using the RISCA provided survey tool. And then I'm going to go over the metrics as well. So the metrics for success for this project, the goal again, as stated by the NEA, is that this is to strengthen social connection and or a sense of belonging through the arts. So the required indicators that we're looking at and grantees are going to report on is participation. So that can be attendance, frequency of engagement, or retention of participants in the project, a sense of belonging and or social connection, and a feeling of overall well-being. And grantees are going to be required to use a brief RISCA-provided survey tool to measure these core indicators using quantitative and qualitative methods. And so because this isn't a research project, but we want to evaluate, we're going to have a simple tool that will be recording participation and then an opportunity for qualitative observation and testimonials. And we know that the projects might be small one-offs or longer 8-week courses, 8-week projects that it's going to look a little different. But for the bare minimum, we're trying to provide a unified tool that everyone will be using. Also, there'll be optional indicators and qualitative methods that applicants and grantees are welcome to talk about and use if for their project they feel that there is something else that would be relevant. So that will be, if those are so used, that will be used as an evaluation criteria as well. So optional indicators and qualitative methods, the grantees are invited to supplement required data with other methods if they choose. And so examples may include observations such as engagement, interaction, or body language, participant, caregiver, or staff testimonials, creative or visual documentation, and then project-specific indicators such as stress reduction, coping strategies, confidence, or physical activities. All right, so that was just an overview of the evaluation criteria and the application. I'm going to go over what you should gather, and then the application, which will also mirror the evaluation criteria. So to start off, you'll want to collect the information. You'll have your 501c3 IRS determination letter, your unique identifying entity identifying number, and recent 990s from your past 3 fiscal years. And if you're new applying and you don't have a UEI yet, you will be able to apply using a placeholder UEI number that we'll give you. But before it goes on to panel, you will have to have a UEI or we'll have to pull the application. Other support materials for panel review is a project budget and project plan on the RISCA templates, a bio or resume of the artists involved, a bio resume of the health advisor or subject matter expert, and then artwork samples. And the samples for this grant are intended to show that the artist or the project, that there's experience relevant to this project. And so it's not just about the artist's particular art form, but how they have experience in this context or examples working with groups. There'll also be a work sample list and then at least one testimonial from a person or people who have experience with this program, the organization, or the artist itself. And now for the application, there's 2 sections to the application. One is the eligibility information that the RISCA staff will review, such as the UEI, the 990, things like that. And the staff will review them, determine eligibility, and if the applicant meets that requirement, to move on to panel. And then the second section for panel review, the panel will not see any of the eligibility information, like the 990, and they don't need to see the nonprofit status letter and things. Just we want them to just focus on the logistics, artistic vibrancy, and program specific. The panel will then, they'll get a chance to learn about the project. They'll review and score it based on the criteria. And so the section for the application, we did a big restructuring for our grants last year, as some of you will know, and the application really mirrors exactly what the panel will be reviewing. So in the logistics, it's check boxes, the budget and project timeline. You put in your grant award request, who's involved with the project. This is just listing the artist, the coordinator, health advisor, where it will take place, the audience, the participant, its number of check boxes of who is it intended for, and then you'll be able to upload your budget and the project timeline. And again, they have to be on the RISCA templates that are provided in the guidelines. Artistic vibrancy and impact. These questions again mirror what the panel review will be evaluating you on. So the question, how is art central to this project? How will the artist provide a positive and purposeful experience for the participants? And how does this project access or engage underserved communities as identified by the NEA? And the sections here are short. We shortened them last year to try to make it easier for the applicant to be clear about what they want to say and what they're doing, and also easier for the panel to review the number of applications that come in and to get them right to the point of what the question is asking. So this is a maximum of 1,000 characters, not 1,000 words, for each question. So for the arts and health section, there's going to be 3 narrative questions and a testimonial upload. So the first one will be briefly describe how this project strengthens social connection and our sense of belonging through the arts. And these arts engagements, again, are non-clinical experiences. Describe how the artists and or the health community partners are integral to the design and implementation of the project. And the third question that is required is the metrics for success. As I described the metrics earlier, you'll briefly describe your plan to measure the core indicators using the risk of provided survey tool. You have the option to use supplemental, to supplement required data with other qualitative methods and or additional indicators that align with your project goals. And if you choose to supplement it with the other qualitative methods and or additional indicators, you can describe below. This is optional, so you will not be counted against, your application will not be counted negatively if you don't use additional tools. We just want to make sure that the applicants, when they're looking at their projects, that you can share what information is relevant for your project in what is determining success. You will also upload a bio or resume of the health professional and subject matter expert, saved as a PDF, and upload a testimonial. And again, this can be quotes or a short testimonial or statement from a person or people who've had experience with this program, organization, or artists. Okay, so now for the application itself, to find it, the state is now requiring all organizations to use a new portal that the state has devised. It is called Unigrants Portal. For some of the organizations who've gotten grants this past year, they're familiar with the system somewhat for the payment process to get payments this way. This is for the application piece, which I think will ultimately make the payment of grants easier in the new year when we use this system. Uh, and I am going to switch screens here, I think, so I can show you. I'm gonna just show you a couple more slides, and then I'm gonna actually show you what the portal looks like. So when you get a copy of these slides, you'll have a link. There's a user guide that the state put together. There's also a link here for the grants portal, and there's also an application checklist on our website. So for the application, when you log in, you'll be taken to a portal. This is the eCivis Una portal. There's a confusion with the names because this used to be called eCivis. They were bought by a company called Una. So we've been using the names interchangeably. So I know there's a lot of things through the state and lots of names and portals. So we apologize for confusion, but that's why we're using both of these names. So this is just a screenshot to show you what it would look like if you don't have an account, you would create one. And then when you get in, this is again a screenshot of there's going to be three sections that you will have to fill out. One is core information, which is just about your organization. And if you're familiar with our other grant portal that Risk has been using for a number of years, Found It, there's a section where you put in organization information, your UEI, your address. Then there's an application section, and then there will be some other required information that the state requires. So I'm going to stop sharing for just a moment. I'm going to switch over screens so you can see what the portal looks like. We'll see how this works. Okay, so this is the RISCA website with the Arts and Health grant guidelines. And again, this will be in the information I'll send in the follow-up. But if you go to the RISCA website and you click on the Arts and Health grant, the guidelines are here. They're all listed. And on the right-hand side, you can also download a copy of the guidelines. There's a copy of the application questions, the budget template, the project plan template, the evaluation criteria we just went through, work samples list template. There's also a link right here that will take you to the portal that you'll need to apply for this grant. And this portal will be different if you choose to apply to the other arts and health grant. There's a different portal you'll be using. So I'm going to click on this and see if this works so you can see this. And when you click on that, this will take you to the new state portal. You will have to log in if you don't already have a login, and then it will take you here. So this is the Arts and Health Grant, has a little overview, and then there's a button here that says apply, and you will click on that, and it will take you to the grant here, and you will see the Arts and Health Grant right here, and you'll be able to click on that. And it will take you to this screen, and you will be able to, you'll see that I'm as an applicant and that my application is in draft, and I will be able to open this, and there'll be different sections. There'll be core information, where, as I said, you'll fill out your organization name and UEI. There'll be the Arts and Health Grant section, which will have the questions that I went over in the PowerPoint slide deck about eligibility. And then there'll be a section that is required by the state of Rhode Island that is a number of questions about entity and what district your voting district is in, and a few other questions. We have no control over that section of it, but and that won't be seen by the panel. The only part that will be seen by the panel will be that section on the logistics, artistic vibrancy, and arts and health. So and I'm not going to go into great detail on this application section. But again, if you have questions, there's a user guide and there'll be other drop-in sessions that I'll be able to help you with. I'm going to go back to the screen, the PowerPoint. Let's see. Just give me a moment. Bear with me. Okay. Okay. We're going to have time for questions. I'm going to just show you at the end that if you need more help, there'll be links for the guidelines. There's webinar recordings and videos on our YouTube channel. I have a link here for drop-in office hours via Zoom. Again, there's going to be other sessions like this, and as well as drop-in office hours, and you can always make a phone call appointment with me via Calendly. I have my email address here. Oops. And I am going to stop sharing, and I'm going to stop the recording.